Kenya is one of the several places around the world where many people do not have any official form of identification. Indeed, the Kenya Red Cross Society estimates that 25% of the people they seek to help have no official ID. This makes it hard for people in this situation to access certain services where identification is required.
Watu hawana makazi ambayo tunaweza sema wanaweza egemea makazi ama kufanya nini. Kwa hivyo wanakuwa na hiyo shida kwa sababu sio wengi ambao wanafaidika hapa. Ni wengi ambao wanakaa vulnerable, hawana makazi na hata na watoto pia wameshindwa kupeleka mashule ni kwa sababu hawana vitu vya kupeleka.
In times of crisis, people without ID risk being left behind. For example, the recent COVID-19 pandemic has had a huge impact on livelihoods across Kenya.
Most of the works where people were working, they were terminated. Especially my people used to go to Eastleigh to do the little jobs, the casual work. But during the COVID, nobody could allow any woman or any lady to enter their houses to do the cleanup because everybody feared the COVID. So most of the people came back, they're just within the estates, they have nothing to eat, and most of the children are malnourished.
Corona imeathiri sana kwanza huku kwa kijiji. Juu kwanza hiyo social distance, huku watu wengi wanafanya kazi ya hawking, lazima mkaribiane na mtu ndio muweze kuwasiliana vizuri kwa biashara. So unaona hiyo social distance ina affect watu wengi. Plus sasa usiku kuna wenye wanahawk usiku, kazi za hoteli, kuna wenye wanafanya kazi za hoteli, hawezi fanya hizo kazi.
The Kenya Red Cross Society, KRCS, recognizes these challenges and is investigating innovative solutions to overcome them. One initiative is through the Dignified Identities in Cash Assistance DIGID project, working with the consortium comprised of the IFRC, Norwegian Red Cross, Norwegian Refugee Council, Norwegian Church Aid and Save the Children Norway. In May 2021, KRCS and IFRC, with the support of the DIGID consortium, piloted the use of digital ID for cash assistance in Mathare and Turkana as part of its response to the COVID-19 pandemic.
Based on the challenges that we face in the communities where vulnerable people do not have identification documents and miss out on humanitarian assistance, the Kenya Red Cross has come up with a pilot project to try and work around digital identification. Digital IDs will ensure, if accepted universally, that everyone have access to humanitarian assistance.
The process is as follows. First, KRCS volunteers register people using mobile phones. Next, the KRCS team cleans up and approves the data in the Red Rose data management platform. The identity technology provider Gravity then receives the request and creates a digital wallet and credentials. The user is now verified and receives the unique QR code. If they have their own phone, they can store and access their QR code themselves. However, many people do not have their own phone, especially in low connectivity or rural settings, so they receive a printed QR code instead. They use the QR code to prove their identity and obtain a token to receive cash. Finally, they present their token to the money distributor and receive cash to spend as they choose.
Mimi nashukuru kampuni ya Red Cross kwa kukuja kuingia katika vijiji ya Lumet na kuona wale watu wanaumia huko vijijini, wale yani ile kitu inawaumiza, hawana vitambulisho na sasa wakakosa msaada. Nashukuru Red Cross kwa kukuja kutafuta mbinu ya hao watu kusaidika. Sasa nimekujia pesa ya nyanya yangu ambaye vidole yake imesumbua yeye tangu akakosa kitambulisho. Na sasa leo Mungu amemsaidia kwa kampuni ya Red Cross, amepata msaada. wakati sasa kama hii ya corona, wakati hata mimi napoteza nguvu mingi kutafuta pesa, saa nyingine nakosa, saa nyingine napata. Sasa hii pesa venye imekuja itasaidia pia mimi kwa upande mwingine, na huyu mama nitafanyia shopping ya kununulia chakula.
Before and during the pilot, KRCS engaged with other NGOs through the DIGID consortium to ensure the technology used in this pilot project would be compatible with other systems. KRCS also spoke with the community to assess their needs and concerns about digital identities.
Through the CEA process, this is the community engagement and accountability process. We have engaged the communities from the inception level, whereby they have been informed of what is going to happen around the project and the piloting phase of the project, and they have been given entire information based on their needs and the questions that they have been asking.
Trust between users and organizations is key for such projects to succeed. As part of this, data security is a priority for cash recipients and KRCS alike.
So this digital identification project has been able to build trust within the community, because we've been involving the community from the registration process, where we were able to explain to them the data that we are capturing from them and how we'll be able to keep it safe to ensure that it's used correctly. And so this has created that confidence for the community in us in this new type of project, and also how we'll be able to treat their data in implementing the project.
Based on the feedback from the community and partners on this pilot project, KRCS now plans to advocate with partners and stakeholders such as government ministries and financial service providers on the acceptability of humanitarian digital IDs to receive assistance such as cash in an emergency context. KRCS also plans to support the technical and operational improvement of the DIGID project whilst developing different opportunities for humanitarian digital identities, for example, volunteer management and health records management.